Hey guys, we need to do some bed surface education, so I thought one of the most efficient ways to do it would be to do a quick video for you guys. We have a couple of things that we need to go over. The first one is going to be the Protivo mattresses and pumps. You will see the Protivo mattresses on all of our beds that are not specialty beds here. First and foremost, the most important thing is that it has a pump and that we have the pump turned on when the patient is in the bed. Next, we would like to see the patient in this alternating therapy mode with the microclimate management. That would be most ideal for our patients. And then last, this area right here, this is not the temperature of the bed, rather the amount of air in the bed. The green is where it should be, but sometimes patients need a little less air and sometimes they need a little more air. So let's make it comfortable for them. The other thing is anytime they're on these specialty mattresses or beds, we want to avoid multiple layers while on these beds. So one chucks should be sufficient with the sheet. If we need more than that, we need to kind of reconsider what's going on. For your guys' documentation requirements, I think this is always an area that we struggle with because we just don't know what to call things. So under skin and wound care, you can choose or select the specialty bed. The microclimate management and the alternating pressure are the two that you would use if they were on the ATP plus MCM button on the Protivo mattress. Here are some quick resources for you guys for the Citadel bed. Obviously, this is a bed that we're going to use with patients who are at high risk for skin breakdown or who already have some breakdown. They would have very limited mobility, and then any of the specialty therapies that would limit their mobility or increase their risk for breakdown would be a candidate as well. Obviously, unstable spines or long bone injuries, which we would not see in rehab, would be contraindicated. And then it does require an order for use. Please don't plug it into the red outlets if you can avoid it. And then make sure the bed is turned on. I think that's a key indicator. We often find these beds in the patient's rooms, but they're not plugged in and turned on, which totally negates the purpose. All right, the Waffle. This is an important one. Nurses, you guys really need to focus and pay attention on this one. You guys have some competencies coming up, and so I want to make sure you guys understand how to place somebody on a Waffle mattress. Waffle mattresses in rehab, you typically won't see because of the Protivo mattresses, but in the rare instance that you do, I want to make sure you guys know that the Waffle mattress is pumped up with the special pump that is sent with it. And that little circle down there, you see the yellow around it, that tells you the number of pumps that you should be putting into the mattress before you place the patient on it. So this one right here is calling for 42. If you're using a seat cushion, Waffle cushion, you can use the Toomey syringe to pump it up. So let's go back to this bed mattress. Once you place the 42 pumps into it, I want you guys to then place the patient on it. And the most important thing that you're going to do is place your hand under the patient at the sacral level. If you have a hard time getting your hand under the patient, you need to probably inflate the pump just a little bit more. And if you cannot feel their sacrum at all, what I want you to do is go down to where the pump is inserted. And I just want you to lightly press it 4 times and let a little bit of the air out. Then you can go back and redo a check. That is very, very important information for you guys to have. Any questions for me, go ahead and email or let me know. I'm also going to send this out in a email format, and then hopefully we'll use it in Huddle as well. I'll talk to you later. I appreciate everything you guys do. Bye-bye.